The types of data that are involved with modern healthcare are numerous. It's not just your traditional claims data anymore. It's far more expansive than that. The amount of healthcare data that we need to push across to actually facilitate real clinical interoperability is tremendous. It's not just EHR data. It's not just claims data. We're starting to bring in information from your watch. We're starting to bring in information from various side systems, patient portals, various types of outreach systems, all to bring together a complete view of the patient's care. That's really what's expected nowadays when we think about interoperability. It's not just your traditional claims data or simple HL7 data feed anymore.
If you're sitting there trying to tie three different EHRs together, you could actually look at this problem with one EHR. Within single EHRs, you have a really big problem tying patients together that just happen to go to different facilities. For some reason, they couldn't be found, and the scheduler creates a new patient record. It's easier to tie that information together within a single EHR. But once you start talking about looking at these problems on a national scale, it becomes really difficult to look at all of the patient data and make sure that you're building a cohesive patient story across that patient. Just looking at a problem as simple as making sure that all of the patient's interactions are tied together before you even get to the data interpretation that you're talking about.
One of the most recent examples of success that we had was around a provider that was able to find out about a patient's cancer from looking at data that we brought together. So this was a patient who didn't speak English, so they weren't a strong champion for their own healthcare in a predominantly English-speaking system. They weren't able to get translator resources for the patient. So by taking the different pieces of data that we had about the patient together from different EHRs, from specialty EHRs that some of this information was hiding in, we were able to paint a 360 view of that patient for the provider, and the patient got the appropriate type of care. That's what real interoperability is all about, is taking disparate pieces of information from silos, building it into a 360 view about that human, about that patient, and getting the right information in front of the eyes of the provider in a timely manner.